Thank you so much. I would like to begin by greeting all the fellow colleagues who have joined in this very important exercise. And I would also like to convey the same greetings from the community of Makerere University here in Kampala. My name is Dr. Okuny Vincent, as already introduced. And indeed, I'm really humbled to be part of this forum to share the experiences that we face all over the world. So I'm going to talk about just highlights, basically observations as pertains COVID-19 and maternal health. To begin with, the first case of COVID-19 was recorded in Uganda on 18th March 2020. Of course, this came with really a lot of fear, uncertainty, and no one knew which direction to take. To date, from the day we recorded the first case, our cumulative cases of COVID-19 as provided by the COVID-19 Response Information Hub in the Ministry of Health of Uganda stands at 162,136 cases. Our mortality stands at 3,549, and so far our recoveries are at 99,376. As of the last 24 hours, as reported, we had new cases diagnosed in a day, standing at 87. Generally speaking, all of us are aware from the first report of COVID-19 that was by WHO as an unclear disease causing respiratory symptoms in China. That was 2019. To date, we all feel the effects of this deadly coronavirus. So to speak, Uganda, being one of the developing nations, have really faced what is unacceptable as a result of the importation and transmission of this virus. Among the key sectors that are highly affected are the highly vulnerable population, and that covers the area of maternal health and child health. As you can see, besides this is a lady. When you see where she's standing on the background, it shows you her hut, which she lives in, and that describes exactly the extreme poverty that some of our communities are faced with. And with the uncertainty of the emerging diseases such as COVID-19, you can really believe what such a vulnerable population can face. Following this, what did we see? What did we observe as changes in our healthcare sector? Among the things we noted, there was a shift of resources from these core healthcare points, such as maternal health and any other relevant sector. Resources were translocated in the bid to respond to COVID-19. Among some of the things we noted, part of the staff that was geared to really provide the basic core healthcare services in relation to maternal health were moved to attend to COVID cases. We also noted budget cuts, both within the Ministry of Health and also other sectors. Now, looking at Uganda, which only gives 9% of the national budget to health, you can see this amount is quite much low, as about 20 years ago when there was a Abuja declaration that at least a country, if we were to attain really the better health indicators should at least give 15% of their national budget to health. But to date, we are still at 9%. So given these meager resources, limited budget, with now the issues of COVID-19, you can see the effect that can bring to maternal health. Some of the things which were there, of course, the obvious basic principles of containing the spread of the infection, such as social restrictions, which was done all over the country, all over the world. But I would say that in our case in Uganda, I think this was applied in a manner that was reasonably not sufficient to really consider other aspects of health. So these curfews, lockdowns, which were either total or partial, really made it worse as far as the delays are concerned in maternal health care. And this definitely will explain where you can really see bad outcomes in the maternal health. Our security officers were mandated to enforce these directives as they were issued time and time by the head of state, some of which did not really undergo any basic training that would be sufficient for you to reason out matters of human rights. So we're able to also record cases of physical, psychological torture as these enforcers implement these directives. Also, we're able to see that the private health providers that augment the service offered by the country in public facilities, really their prices shot up, and this made it almost not affordable to our mothers, simply because of issues of PPEs, fear, the risks that the health workers were looking at, and this make them to charge exorbitantly high prices to the clients. On the other hand, there were efforts to mobilize resources in order to respond to COVID-19, and this was seen as at the individual level, at the level of companies, the state, non-governmental organizations, but all of them, the resources gathered were strictly directed to the COVID-19 response. We also note that foreign support in form of donors really reduced completely, and this really made the implementation of healthcare provision in the line of maternal health practically impossible. So what effects did this really leave on the maternal health? Maternal mortality definitely went up, whereas at that time we really had also challenges on our surveillance system to really report on this, since all sectors were paralyzed. But we believe it could be really high if we really had the figures. So how did this happen? One of the things that explained this maternal mortality, mothers themselves were in fear even to get to the health facility, in the mind that I may contract COVID-19 when I go to the health facility. Some of them also having been subjected to torture by the security personnel who were enforcing this curfew, social restrictions, lockdowns, also created fear to make them really impossible to go to access the healthcare services. And then also inaccessibility to contraceptives. During this time, the whole issue was on core survival. So services like family planning really became almost not available. And as a result, we're able to see increased number of unwanted pregnancies and it is associated bad outcomes. Among them also was a rise in teenage pregnancies. Some statistics show that it is as high as 35 to 40 in rural setting, but on average stands at 28%, which is slightly high as compared to before the COVID outbreak. And of course, this also definitely makes it worse, since these young girls, some of them are not naturally ready for the consequences of reproduction, more so delivery. So this came up with a number of complications, and this is barely because our schools were closed from March 2020 until last year. Until last month, around 10th, that's when we fully reopened. And yet these institutions were acting as a protective centers for our young girls against sexual violence, child marriages, exploitation, and abuse. Among other effects, of course, is the aspect of single parenthood. And of course, it is associated economic and psychological effects to mothers. Some men ran away from their homes because they were not working. They lost job. There was no work, and they were supposed to provide for the family. So someone will have no option but instead to leave the home. And this created a number of things. Some of them died as a result of COVID-19, and so on and so on. Then, of course, as earlier said, there was disruption of the general reproductive health core services provision, and this definitely resulted in bad outcomes as far as maternal health is concerned. Challenge of knowledge when it pertains to mothers who had COVID-19. Then also issues of the increased costs, which are already said by the service providers on private basis. Then aspects of domestic violence. This also impacted on maternal health, simply because all the parents were at home. You are in a lockdown for 2 months. You're not doing anything productive. The family needs to be supported, and that created a number of issues. Parents had lost jobs, so there was knocking of heads here and there, what to be done to support the family. At one time, government came up with a bailout program where food was supplied, money were given to some families which were really in most need, but this was not adequate, so it did not solve the problem. So where are we now? Of course, we are all aware the outbreak is still there. As I told you earlier, that in the last 24 hours, the samples are tested among our people, 87 of them tested positive. And of course, we are also aware of the variants as a result of viral mutations, and we are not uncertain what will be their effects to the maternal health. Yes, vaccines are now there, but our vaccination coverage is still an issue, simply because of the issue of accessibility to vaccines, and also the population being skeptical on the safety of these vaccines for the rest of the population as well as mothers. Then, our maternal health care still is lagging. We have not yet, much as now, we have fully reopened the economy in the last 3 weeks. Our maternal health care services are still not in good shape, simply because government has no money. There was total economic decline as a result of the effects of COVID-19, lockdown, curfews, and so on. Our schools, yes, open. We resumed fully on 10th of last month, after having almost 2 years of disrupted operations in our educational institutions. So we are not sure whether this is not going to throw us in the next wave of COVID-19. But needless to say, whereas children are going back to school, there were these young girls who were schooling, age 12 to 17, that got pregnant. Now they have children. So you can see a child taking care of a child. They are in that dilemma. Should I get back to school? Who is going to remain take care of the child? So it's a real challenge as far as maternal health is concerned. Then, what is happening now? Still, there is a total effort on national concentration on COVID response, whereby there are really multi-stakeholder task force generated, and the focus is really in the direction of the whole energy, state energy is pushed in an attempt to really contain the epidemic rather than attention to core essential areas of health, such as maternal health. So what is the way forward? I think I may not have a clear answer now, but we feel there should be global attention so that the response is in line of resource sharing. Whereas there are hopes on vaccination, some countries, such as Uganda, still has issues on accessibility on these vaccines. Finally, I would wish to hear your opinions and your experiences. But this simple animal you see here is one of the tall animals that is able to see a long distance when it stands upright. And by virtue of that, it tells you that when it starts running, it shows you there is danger. But when they are now calm like this, it means there is peace. So I would like to say that you are safe only if all of us are safe. I thank you all.